I got interested in DiSHI in 2018. At the time, I was leading a HIV and AIDS prevention and treatment program in Nigeria, and I was interested in integrating digital technologies to improve outcomes for people at risk of HIV or those living with HIV. My belief was that digital technologies could be leveraged to improve their health outcomes. And during the literature search, I kept coming across articles on Gadget Online, which is run by DiSHI, and I was intrigued at the similarities and challenges we face with digital technologies. But more importantly, I was intrigued by the attention to GCO's design and implementation and how that could improve the outcomes for people who experience marginalization. In a visit to Vancouver in 2019, Mark was gracious enough to take a meeting with me. And during that discussion, I kept thinking to myself, gee, wouldn't it be nice to work and learn with this team? So when the opportunity came later that year to do a PhD with the team, of course I jumped at it. My study is on digital health equity in online STI testing services in British Columbia. It's an sequential explanatory mixed method study that aims to understand how the features of GetChecked Online, in terms of its design, differentially affect attrition from online STI testing among users who come on the surface but experience attrition at any point in time. For now, we know much about 40% of people who do come on the platform and actually complete the service, but we don't know much about the rest of them who do not get the service. And one concern we've had is how the design of the platform itself plays into their process of attrition from the service. Therefore, my study will use clickstream data, which is data that tracks how people behave online and respond to the design features of a website to understand how attrition may occur differentially among people of different socio-demographic characteristics. My hope at the end of the day is that using clickstream online data, we may, unlock interesting and new ways to link web-based metrics to user characteristics in a way that helps us understand the place of design in GetChecked Online's ability to grant or foster access to online STI services in a way that helps us to further adapt the platform to foster our dreams or aspirations for equity. This kind of research introduces much needed nuance into the discussion about the role of digital technologies in improving access to quality healthcare. Much of the discourse has been rather deterministic about, the role of digital technologies as being, the one way forward. But closely considering design features of platforms can actually improve the equity, the way it grants access to care in a way that's equitable.